All right, so this video is going to explain how to access and fill out or use the diabetes education order panel. So all education and management services, including nutrition for patients with diabetes, are going to be ordered using the Diabetes Outpatient Education Services order panel. How to get to that, you're going to, in your encounter, using the search terms either diabetes, education, or nutrition will bring up the order panel. If you use the word dietitian or the word referral, it will not come up. So you'll use diabetes, education, or nutrition. Once you type that in, it may automatically come up under your order panels if you've used this before or if you've saved it to your preference list. But if not, if you type in diabetes and nothing comes up under your order panels, you may need to select the facility list in the window, in the order search window, in order to be able to find this order panel. So once you accept that, then the panel will come up. The top part is going to explain the different services available through the diabetes management department, but I'm going to go through each one by one because a couple of them are kind of tricky. First thing that you'll see is the diabetes education order. Diabetes education is a comprehensive education and support regarding specific topics such as disease process, complications, blood sugar monitoring, general nutrition, exercise, medication. So when you pull up the diabetes education order, the first thing that you're going to be asked is if the patient has a barrier to receiving group education. So if you answer yes, then a pop-up is going to ask you to specify the barrier. So obviously if they have vision or hearing, or if they, English is not their primary language, something like that, you'll specify that. After you've indicated whether or not there's a learning barrier, obviously what type of diabetes do they have? And then you'll need to select if this is their initial diabetes education, they've never had diabetes education before, or if it's follow-up education, they have had diabetes education in the past. If initial education is selected, first of all, the scheduler that gets this order is going to do their best to verify that they have not had education in the past. Sometimes, the provider isn't going to know whether or not this patient has ever seen the diabetes educator before, and select initial education. We'll double check to make sure that is the case. So when initial education is ordered, we'll assume that it will be provided in a group setting, and that all of the required content area is going to be covered unless the provider has indicated a barrier up above here. If that is the case, if they've indicated a barrier, then the patient is going to receive 10 hours of education individually, but still covering the same topics as we would in the group setting. Do be aware that Medicare will only cover group education as the patient's initial training unless a barrier is identified. In some cases, the provider may want the patient to receive their initial education in a one-on-one setting, even if there are no barriers. So if that's the case, then you're going to choose up to 4 topics selection, and then indicate the specific areas that you want the patient to learn. Again, the patient should be made aware that even though the provider ordered one-on-one education, it may or may not be covered by their insurance. So if that is the case, we will provide the patient with the CPT code and they can check their coverage on their own. If the provider chooses follow-up diabetes education, another menu is going to pop up allowing you to select which topics you want covered. This part is required by Medicare to have on the referral. So even if they're coming in for their follow-up education and you want them to talk to us about all of these things, that's perfectly fine. Select all of them. If you are saying they, only really need to talk about nutrition, then obviously just select nutrition. So next on the panel is the pregnancy diabetes education order. And this is meant for all pregnant patients with type 1, type 2, gestational diabetes, or pre-diabetes. So you'll obviously need to indicate what type of diabetes they have. And then you will need to indicate if the patient is to receive diabetes education, which is going to include things like pathophysiology, general nutrition, blood sugar monitoring, etc. Or if they need insulin management or both. So for pregnancy diabetes education, you're going to specify which topics you want to be covered or select all of them. We have recently started offering group pregnancy diabetes education at St. Joe's, and we will be rolling out group pregnancy education at CSM Milwaukee and All Saints, probably in spring or summer of 2022. So the order may be changing a little bit, the look of the order may be changing, but for now, whether the person is scheduled for group education or one-on-one education will depend upon certainly if there are any barriers as above, the vision, language, those sorts of things, or if the patient is unable to attend classes at St. Joe's or CSM Milwaukee or All Saints, if they can't get to any of those areas, then of course we will see them at one of our other facilities in a one-on-one setting. If insulin management is selected, you're going to be prompted to indicate whether this is an insulin start, and they'll be taught how to give the injections, or if it's an insulin, if it's a change to their previous insulin type or dose. You can also indicate if you'd like the diabetes educator to manage or titrate their insulin with weekly or even bi-weekly follow-up. If this box is not checked, then we will just do the sort of, the insulin instruction and assume then that the provider is going to take over any adjusting of doses. When you see this schedule within field, know that that was initially meant for central scheduling, but we're no longer scheduling that way. So our schedulers, when they get the order, they're going to call the patient within 48 hours and get them scheduled as soon as possible. If there isn't an educator available, an opening available within 1 week or sooner, if they're supposed to come in for insulin, the scheduler is going to call the diabetes educator directly so that we can squeeze them into the schedule and get them seen as soon as we can. Medical nutrition therapy is an additional and complementary service to diabetes education. You may order either service, but we encourage you to order both. Diabetes education and medical nutrition therapy are provided by the same educator. So ordering both services will basically just allow us more time with the patient. The medical nutrition therapy order is pretty simple. You basically only need to indicate if there is if this is their initial training, meaning they've never seen a dietitian before, or if this is follow-up. They have seen a dietitian in the past and are coming in for more education or follow-up. Now, medical nutrition therapy is more personalized nutrition education and counseling versus the nutrition education that's provided within diabetes education. So when, you will notice that within the diabetes education order, nutrition is one of the topics, and that is really more kind of just basic nutrition education. Whereas medical nutrition therapy involves also, again, kind of personalized, more nutrition counseling. So again, we encourage you really to order both for patients. Continuous glucose monitoring is to be used when a patient is starting on either a Freestyle Libre or a Dexcom. It's not meant for teaching a patient how to use their regular finger stick meter. That's included in regular diabetes education. So with the CGM order, you'll need to select if the patient is coming in with their own equipment. The Libre or the Dexcom has already been obtained by the patient, or if they need to have professional or diagnostic CGM, where the patient is going to wear the sensor for 2 weeks and then come back in. We will download that information and then be able to use that for further education and treatment decisions. Insulin and non-insulin injectable education is to be used if a patient needs to learn how to use insulin or one of the other injectable diabetes medications, or if they're currently on insulin but need help with the dose adjustment or titration. If the medication dose titration box is not checked, the educator is going to assume that the provider will be the one adjusting the doses. Insulin pump education, that order has 2 options. Evaluation, assessment, pre-pump education will assess if the patient is appropriate for a pump and has the necessary knowledge, skills, motivation in order to manage insulin pump therapy. Insulin pump titration and self-management is to be used for a patient who's already on a pump, but maybe needs ongoing assistance or education in order to use and manage their pump safely. And then lastly, pre-diabetes education is to be used if the patient does not meet the criteria for a diabetes diagnosis, either the A1C or fasting blood sugars are elevated but not high enough to merit a diabetes diagnosis. Be aware that Medicare does not cover pre-diabetes education, but of course the patient will be given the option to pay out of pocket. And for non-Medicare patients, again, we'll provide them with a CPT code, if they want to call their insurance and check their coverage. So if you are having any trouble using the order panel or knowing what to check, that sort of thing, feel free to reach out to the diabetes management department. The best way to contact us is by calling 414-259-7585. That'll be the scheduler who can either answer your questions and help you navigate the order, or she'll put you in touch with one of the diabetes educators who can help you out further.